Organ transplantation is a marvel of modern medicine. It offers a lifeline to patients facing organ failure, promising renewed hope and extended life. Through the transplantation of organs like hearts, lungs, livers, and kidneys, we can alleviate suffering and grant a second chance at life. These procedures are testaments to human ingenuity and our relentless pursuit of conquering disease. However, this life-saving intervention is not without its perils. One of the most formidable challenges in transplantation is the risk of rejection. This occurs when the recipient's immune system identifies the transplanted organ as foreign and mounts an attack against it. This rejection can lead to organ failure and potentially fatal consequences, underscoring the delicate balance between the promise and peril of transplantation. GVHD primarily occurs in transplantations involving bone marrow or stem cells, but can also manifest in organ transplantations, albeit less frequently. In bone marrow transplants, the donated marrow contains T cells, a type of white blood cell that forms a crucial part of the immune system. These T cells, originating from the donor, may perceive the recipient's body as foreign and initiate an immune response. This immune response can affect various organs and tissues in the recipient's body. Skin rashes, gastrointestinal problems, and liver dysfunction are common manifestations of GVHD. The severity of GVHD can range from mild, with manageable symptoms, to severe, leading to life-threatening complications. The timing of GVHD onset also varies, with acute GVHD occurring within the first 100 days after transplantation and chronic GVHD developing later, potentially persisting for years. While less common than in bone marrow transplants, GVHD can occur in blood transfusions. This is known as transfusion-associated graft versus host disease, or TAGVHD. TAGVHD arises when the transfused blood contains immunocompetent T cells that recognize the recipient's body as foreign and mount an attack. TAGVHD is a rare but serious complication, often presenting with severe skin rashes, fever, liver dysfunction, and bone marrow suppression. It typically occurs within a few weeks after the transfusion and carries a high mortality rate. The risk of TAGVHD is higher in individuals with compromised immune systems, such as those undergoing chemotherapy or suffering from immunodeficiency disorders. Due to the severity of TAGVHD, preventive measures are crucial. Irradiating blood products before transfusion is a standard practice to inactivate donor lymphocytes and minimize the risk of TAGVHD. This process involves exposing the blood to a controlled dose of radiation, rendering the donor lymphocytes incapable of mounting an immune response against the recipient. Section 4. The fight against rejection, prevention, and management of GVHD. Preventing and managing GVHD is a critical aspect of transplantation medicine. Given the potentially devastating consequences of GVHD, strategies are employed to minimize its risk and mitigate its severity. These strategies involve a combination of careful donor selection, immunosuppressive medications, and supportive care measures. Matching the donor and recipient's human leukocyte antigen, or HLA type, is crucial in minimizing the risk of GVHD. HLA are proteins found on the surface of cells that help the immune system distinguish between self and non-self. A close HLA match between donor and recipient reduces the likelihood of the recipient's immune system recognizing the donor cells as foreign. Immunosuppressive medications play a vital role in suppressing the recipient's immune response and preventing GVHD. These medications work by inhibiting the activity of T cells, the primary culprits in GVHD. Corticosteroids are commonly used immunosuppressants, often combined with other medications to enhance their effectiveness. The dosage and duration of immunosuppressive therapy are carefully tailored to each patient, balancing the need to prevent GVHD while minimizing the risk of infections and other side effects. Section 5. Advancements in the field. New hope for GVHD patients. The field of transplantation medicine is constantly evolving, with ongoing research and clinical trials aimed at improving the prevention, management, and treatment of GVHD. Advancements in HLA typing techniques allow for more precise matching between donors and recipients, reducing the risk of rejection. Novel immunosuppressive medications are being developed with improved efficacy and reduced side effects, offering a better quality of life for transplant recipients. Cellular therapies are emerging as a promising avenue for treating GVHD. One such approach involves using regulatory T cells, or TREGs. a specialized subset of T cells that suppress immune responses. TREGs can be isolated from the donor or generated from the recipient's own cells, and then infused back into the patient to dampen the immune attack against the recipient's tissues. Another promising area of research focuses on developing targeted therapies that specifically inhibit the pathways involved in GVHD without compromising the entire immune system. These targeted therapies aim to disrupt the specific interactions between donor T cells and recipient tissues, preventing the cascade of events that lead to GVHD. This precision medicine approach holds the potential for more effective treatment with fewer side effects, improving the long-term outcomes for GVHD patients. Section 6. The future of transplantation, towards safer and more effective therapies. The journey of transplantation, from its experimental beginnings to its current status as a life-saving intervention, is a testament to human ingenuity and perseverance. As we venture further into the realm of transplantation, we are confronted with the complexities of GVHD, a formidable challenge that demands our continued attention and innovation. With each passing year, our understanding of GVHD deepens, leading to more effective prevention strategies, improved management protocols, and novel therapeutic approaches. The future of transplantation holds great promise. Ongoing research efforts are paving the way for safer and more effective therapies, minimizing the risk of GVHD and improving the quality of life for transplant recipients. Through continued advancements in HLA typing, immunosuppressive medications, cellular therapies, and targeted therapies, we are edging closer to a future where transplantation can be performed with minimal risk of rejection, offering a true lifeline to patients in need. As we strive towards this future, let us remember the delicate balance between the promise and peril of transplantation. GVHD stands as a stark reminder of the complexities of the human immune system and the challenges we face in manipulating it for therapeutic benefit. Yet it is through our relentless pursuit of knowledge, our unwavering commitment to innovation, and our unwavering empathy for those suffering that we will ultimately conquer these challenges, ensuring that the miracle of transplantation continues to offer hope and healing for generations to come.